Can you identify the type of digital impression being used in this video? Welcome to today's video where we will explore the basic of digital impressions and how this cutting-edge technology is transforming modern dentistry, from capturing precise 3D images to ensuring accuracy in dental restorations. Let's dive into the foundational principle behind digital impression. So we will start with the first and most traditional approach. In this approach, the conventional impression is taken and cast is obtained, which is sent to the laboratory for digital scanning, and a virtual cast is fabricated. On this virtual cast, designing is completed and milling is also performed in laboratory. Now the final process is sent back to the clinic for the final delivery. In the second workflow, intraoral scanner is used, skipping the impression and the cast steps, and the visual scan is sent to lab directly for designing and milling. The final processes is then delivered to the clinic. The third and most rapid workflow involves completing all steps scanning, designing, and milling in the clinic by the prosthodontist, and the final processes is delivered to the patient in a single visit. Advancement in 3D imaging have expanded its use in dentistry, including restorative work, orthodontics, and craniofacial surgery. Although these images seem accurate, dentists should understand how they are made and critically evaluate what they represent. So, what are the principles behind 3D impression surface imaging? Devices that map an object's surface and collect 3D data come in two types: contact and non contact scanners. So, as the name suggests, contact scanners they directly touch the object being scanned. They work on the principle of coordinate measuring machine and designed to move a measuring probe over a surface to determine its coordinate. The four main components are measuring probe, computing system, machine which moves the probe, and measuring software. So here comes the example of contact scanner inside system by Renishaw, where ceramic shaft and ruby ball tip is used. These scanners are basically for hard surface scanning like gypsum product, and they are very accurate, but they are relatively slow as compared to non-contact scanners. Now, coming to non-contact optical scanners, as the name suggests, they do not physically touch the object being scanned. There are several principles like triangulation, conofocal microscopy, photogrammetry, stereoscopy, and French method, and so on. The most common method is triangulation method, where a light source is directed onto the object's surface and a camera-like device such as a charge-coupled device or position-sensitive detector record the location where the laser beam strikes the surface. So, raw data from the 3D scanning is known as point cloud, which represent the surface's 3D coordinates. Using software, these points they are connected into a polygon mesh, typically made up of triangles to form a virtual surface. Now, this polygon mesh, with the help of softwares, can be shaded and textured to form the final image. The accuracy of the final image depends on the point cloud density, which itself is influenced by scanners, hardware, and software, operators' technique, and time spent. Here comes the example of some intraoral scanners, the working principle they have used, and the light source they have used. For example, CEREC scanner use triangulation method and conofocal microscopy, whereas ITERO used parallel conofocal microscopy technique, and MI used active stereoscopic vision. Some of the scanners use blue light or other visible light as a light source, and laser is also used in some scanners. Some of the optical scanners also provide the in-office milling. Coming to the advantages of digital impression, there is no impression taking or casting, so it is reducing the manufacturing steps. Also, the direct chairside fabrication of various type of restoration in one appointment without the need of any provisional restoration. It reduces the laboratory and chairside cost. However, there is initial expenditure on the CAD/CAM equipment to consider. So, like any technology, intraoral digital scanning is not without its challenges. Issue can arise at various stages of prosthesis fabrication. That's why it is crucial for specialists, especially prosthodontists, to have a deep understanding of the process. Proper knowledge helps prevent problems caused by inadequate scanning and equips you to find solution when issue arises. So if you are planning to use digital scanning, make sure you fully understand the technology and address any uncertainties. This way you can achieve the best possible results and make the most of this powerful tool. I hope now you know the answer to the question asked at the beginning of the video. Feel free to replay it and give it a try. Thank you so much. Please do like, share, and subscribe.